Food and Drug Administration panel recommends a decades-old birth control pill be sold without a prescription. Julia Rovner, the chief Washington correspondent for KFF Health News, joins us this morning. Thank you so much for being with us.
Sure, thanks for having me.
Okay, so this decision, obviously, still months away, but it has unanimous support from this panel. Does that surprise you?
No, I mean, this has been a long time coming. A lot of medical organizations have been advocating to have over-the-counter birth control pills available. They are much more effective than other forms of over-the-counter contraception. There's been this back and forth about whether doctors need to be involved before women, and particularly teenagers, take these pills. But it was actually two different advisory committees working together, voted unanimously that the benefits outweigh the possible risks.
Yeah, I'm trying to think. When I think a lot of women, when they go and they talk to their doctor and just to get the prescription, I don't even know if the doctor really even talks to them about that. It's kind of just really quickly written, and you move on, it seems. I think one thing that would be a concern, though, would be like insurance coverage for some people.
Yes, that's true. I mean, this was a big issue a couple of years ago. Republicans in Congress started pushing for over-the-counter birth control so they could get out of the complicated issue of religious organizations not wanting to provide it as part of their insurance, because largely over-the-counter medications are not covered by insurance. Now, there are some exceptions. If you get a doctor's prescription, you can get over-the-counter medications covered. But generally, people are going to have to pay for this themselves, and there's a concern that that could also be a barrier, but probably not as much of a barrier as having to, make a doctor's appointment, go to the doctor, get the prescription, take the prescription to the pharmacy.
Yeah, you mentioned Texas teens, or teens in general, I think. And they've been required to get a prescription, but also parental consent when it comes to contraception. I guess that could be, the discussion on that conflict.
Yeah, this is clearly an ongoing fight. There are federal rules that require teenagers to have privacy when visiting federally funded family planning clinics. Obviously, Texas is challenging that, and it's being litigated now. But in most of the country, teens are allowed to go and get at least contraception without their parents' knowledge.
All right. If this continues to move forward, what's the earliest we could see this happen?
The FDA makes its decisions when the FDA makes its decisions. It could be as soon as a month or two. I've seen the FDA sit on advisory committee opinions for, more than a year. There was a huge fight some years ago about making the emergency contraception pill, basically high doses of these same types of birth control pills, available over the counter. It took 13 years to get that over the finish line. So it could be soon, and it could not be soon.
All right. We will see. We want to mention you also host a KFF Health News weekly policy podcast as well, and we're going to put a link to that because I know you got a lot of information on there as well that's very helpful at fox4news.com for those who would like to join. Thank you so much for your insight. Appreciate it.
Sure. Thank you.